Good morning, everyone. I'm delighted today to welcome Carla Parker-Hollis, who is serving right now as the Chief Operating Officer at Jersey City Medical Center in Jersey City, New Jersey, which is part of, I think, the largest health system in New Jersey, one of the largest, if not the
largest. Yes, it is the largest, Kathleen.
There you go. And a little bit about Carla's background before I have her kind of tell us more about herself. You were formerly the CEO of Triangle Health, President and CEO of Columbus Regional Hospital. And when I got to meet you many years ago, you were not many years ago. Well, yeah, it was many years ago. You were the Vice President of Operations and Chief Planning Officer at Duke Rawley Hospital down in North Carolina, which we were so delighted to work with you for a number of years. So we're happy to have you and welcome you today to talk about authentic leadership. And so what I'm interested in is, because what I think is so exciting, you're one of the few non-nurses who have been so successful climbing the ladder, if you will, in healthcare. So tell us a little about your career path to healthcare.
Absolutely. Well, first of all, Kathleen, thank you so much for having me, and be careful with those reference to many, many, many years ago, okay? Because we don't want to age ourselves. But no, I really appreciate the opportunity to speak with you. And as you said, I don't have a clinical background and work with many wonderful people who do, but my background, or sort of my pathway into healthcare, really started more on the business development side, working with a communications organization, which led me to my first healthcare position, which was really focused on business development and physician recruitment, which I think of as sort of relationship building, right? And friend raising, if you will. So that's really what led me down the pathway to healthcare, which has been just an amazing career for me.
I love that too, relationships, which is what our whole—
Absolutely. It's what we do every single day as leaders in healthcare.
The most important thing. So when we talk about leaders, some people shared their parents were the most influential leaders growing up. Some people, it was within their church or someone that they worked with. Can you think back and reflect on what leader influenced you the most, certainly about becoming a leader and seeing potential in you?
Yeah, and I want to sort of approach this both from a personal perspective and a professional perspective, because clearly, I think all of us who reach certain platitudes in life have an opportunity to reflect back on their childhood, right, and mentorships when they start, and certainly I consider my parents the most important mentors in my life. My father was a police officer, and I always believed was a human lie detector too. So I was always very good with telling the truth. But certainly, I was able to see him as a leader, as a servant leader. And I've always been drawn to individuals who work in those capacities. So certainly my parents, I think, were the first folks to really influence me around leadership. But when I think back professionally, there is someone who is very important to me in my growth professionally. An individual by the name of Doug Venzel. I had the opportunity to work with Doug for 6.5 years during my tenure with Duke University Health System, and I was able to observe from him what it meant to be a leader, but a leader who led with heart and compassion. Doug always said, he led by walking the halls of the hospital, and he led by knowing his team members, by knowing something about them, by being able to ask about their family. I remember every Christmas in working with him, he and his wife would make cookies and bring them to the hospital on Christmas morning for staff. And he was an inspirational leader. He was certainly strategic. He was certainly visionary. But he led by heart, and that's something that has really influenced me.
Oh, I love that. And we don't see so much of that anymore these days, or we don't get to see that caring human side. I love that. Right. That who influenced you. Was it Doug or others that saw the potential in you to grow in your role? Tell us a little bit about who said, Carla, did you always have a drive to be in, as I was, bossy boots, or did someone see that in you and pull it out of you and encourage you?
Yeah, well, certainly Doug was one of those individuals, and I've worked with many who have served as mentors and have really encouraged me to really hone in on my leadership skills, to advance my education, to take advantage of every opportunity that came to me to continue to grow. Who gave me additional responsibilities, and I've always been one of those individuals who wanted to take on more, who wasn't afraid to do that. Sometimes I probably should have been afraid to do that, but I always saw it as a gift and a real opportunity. I can't think of any, one potential
Mhm.
incident or a time and place where I said I want to be a leader. It was more of an evolution for me, but I've worked with great organizations my entire career, including now with RWJBarnabas Health and with Duke University Health System, that really mentored their staff. And we're always there giving more learning opportunities, tuition reimbursement, encouragement. So all of those things have really led me down the leadership pathway.
That's wonderful. I always say you were raised correctly in the right environment where they encourage
Right,
continuous learning. And we know for all of the research done on extraordinary leaders, they're continuous learners, like to grow
right.
and learn. I love that. So the topic this session was authentic leadership. So um, tell us about, your feelings about the difference between an authentic leader and perhaps someone who was not authentic. And have you had experience with,
Yeah,
certainly sounds like Doug was an authentic leader. Have you had
absolutely.
experience with others? Talk a little bit about the authenticity part.
Sure, absolutely. And it's funny how, I reflect on the term authenticity or being authentic. And it's kind of become one of those catchphrases. We use it a lot, but I do think authenticity is really fundamental to everything that we do. And for me, it's both an internal and an external projection, right? I think if you're authentic, you're true to yourself, and you're true to your own set of values without wavering from those. I think others see that, they know that. I've certainly worked with individuals who I didn't believe reflected that, whose leadership sort of went with the wind, if you will, and not being grounded in what was, really being true to yourself and true to others. So, I authentic leadership to me is paramount, and you know it when you see it. And you know it when you don't see it. And I've had experience with both. And it's one of the things that I think about a lot. And certainly, again, at the end of the day, if we're authentic leaders, we're being true to the individual that we are, and others know that.
And that was, we talked about that a little bit. It's hard to, when you're having congruencies, when
Right,
you believe one thing, but you're kind of called to do another. That's when truly an authentic person has to share their
right.
ability and say, yeah, this is hard for me too. So
Absolutely. I think a good example of that is really around staff engagement. I mean, staff engagement isn't about a score. It's about what you do to engage your staff, right? And if you're only focused on the metric or what's behind the equal sign, then you're not authentically raising the engagement of your team. And it's just so important to focus on what's real, and everything else will follow.
I love that. I love that. When you look back on your illustrious career path, how have
Many,
you,
many year career, right?
no, you're right. A short time ago when you were a young lassie, um, how have you grown as over your career path? How have you grown as a professional? What are the key areas that you've kind of worked on and really kind of proud of that you've developed?
Yeah, I think, well, first of all, I think, we grow in our career every day as we grow personally. And I think we do that with new challenges, new assignments. I think we do that with new direct reports and new reporting structures because we find opportunities to grow with everyone. And, I've had the opportunity to work both in different organizations and in different parts of the country. Right now I work in one of the most diverse communities in the United States, and that has really helped me grow as a leader. And I think to have more focused understanding of how unique we are as individuals, but how rich that is. from a leadership perspective. And, I think as I've advanced in my career, one of the things that's been really important to me as a leader is to be a mentor, and less self-focused and more focused on others, and really having the opportunity to help them achieve their goals. Because at the end of the day, those are if we're consistent, those are the goals of our organization, and it makes us a better healthcare provider. So, I mean, again, I think it's just been so important to be able to work with great organizations in different communities, and to learn from everyone that I've worked for and who's worked for me.
Love that. And we've talked about in our authentic leadership session about self-awareness is so important. First of all, know
Right.
who and what, but to be an authentic leader, you have to have good social awareness. You have to be
Right.
able to, and social management, be able to build those relationships. So what a wonderful opportunity you've had to be exposed to all different kinds of lifestyle, not lifestyles as much as people's
Right.
professions, cultures, and help them grow with you. That's great. Wonderful.
Yes.
Wonderful. And so as we close up here, what advice can you offer these new emerging leaders about being true to yourself and maintaining a spirit of authenticity as a leader?
I think believing in yourself, and that seems simple, but it's often not. And I think those times when self-doubt creeps in, and it can be very crippling, it's easy to have that self-doubt about yourself, but believe in yourself, and believe in your goals and your vision. And I think as a healthcare leader, I think the one thing I would say to you also is, whatever you do, whatever your role is in healthcare, whether you're taking care of patients at the bedside or you're sitting in the C-suite, make the patient the core of everything that you do. No matter what that is, what is the right thing for the patient at that moment in time, and let that be your guide. And it's sometimes it doesn't always come down to that, but make sure that that's always in the back of your mind, because that's what we do. That's why we're here. We're taking care of people at the most difficult times in their life. And don't ever let that escape what you believe to be the most important thing, the most important decision that you make in that moment. So those are a couple of things. And the one final thing I would say, and particularly as you continue in your leadership journey, lend a hand to somebody else, because we're all human beings. We may be struggling with a professional issue, a personal issue. Do that, lend a hand, do it authentically, offer your time, offer your ear. You never know the difference that you're going to make in somebody's life.
Oh, you gave me chills. That's a wonderful closing. And I had a flashback to my first most influential leader, Mike Azara from Valley Hospital. And he said the same thing. If you keep the patient at the center of what you're doing,
Right.
you're making a right decision.
Yes.
Powerful words. Thank you so much, Carla. We appreciate your time always, and you have a wonderful rest of the day.
It's been my pleasure, Kathleen. Thank you so much.